Information about the importance of protecting children from coronavirus. A new study finds that young children may be able to spread the virus just as easily as older kids and adults. Researchers at Lurie Children's Hospital of Chicago compared the amount of virus from 145 COVID patients who had mild or moderate illness within the first week of symptoms. And they found that kids under the age of 5 had a higher amount of virus in their upper respiratory tract than older children and adults.
So this study, the information coming from this, likely going to factor into all these conversations about reopening schools in the fall. Safety plans are being worked on across the tri-state as we speak. But for one district in New Jersey, going back into classrooms may not be in the cards.
And News 4's Rana Novini is in Bayonne now with reaction from parents and students there. Rana.
Yeah, Natalie and Stefan, as you'd imagine, mixed reaction from parents and students here. The Bayonne School District has nearly 10,000 students. The superintendent tells me they ran some readiness drills in their schools and found that at least starting the school year all remotely would be the safest plan.
I want to be either an ornithologist, a herpetologist, or a paleontologist.
10-year-old Isif Ibrahim has big plans for the future. He helps out at his parents' store and knows school is important, but he says his family's health comes first. So come fall, his mom says Isif and his little brother will be learning virtually.
For me as mom, the most important thing is safety first.
I've been seeing the numbers in Hudson County. It's pretty low, but still we got to take care.
The family is glad to hear Bayonne School District feels the same way. In a letter to parents, the superintendent says the district submitted a plan to start the school year with everyone doing remote learning. But New Jersey state guidelines sent out last month call for all public schools to submit a plan with some in-person learning.
We're going to figure it out, but the safest route that we think and we voted on was the all virtual platform.
The superintendent says he's also submitted a hybrid learning plan, but hopes the DOE lets them stay virtual. He says schools in Bayonne are old and already at capacity. Social distancing and screening for COVID symptoms would be difficult, not to mention getting enough PPE for staff and students.
I work full-time. I'm a single parent. I work for a doctor. So me staying home is not particularly available for my kids.
Moms like Stacy Sanchez think having some in-person learning would be helpful, but she's trying not to worry either way.
But I also do feel that it's something that can always be caught up on. It's not something that's the end of the world.
And of course, no matter what happens, parents can still opt to choose this all virtual learning plan no matter what. Bayonne School District expects to hear back from the State Department of Education sometime next week as to whether or not their plan would be approved. We reached out to the DOE for comment, but so far have not heard back. Reporting live in Bayonne, Rana Novini, News 4, New York.
Okay, Rana, thank you so much. The doctor is in to answer some of your questions about coronavirus. Dr. Kavita Patel, an NBC News medical contributor, joining us live this afternoon. Always good to see you, Dr. Patel. Just a few minutes ago, we talked about this new study released in JAMA Pediatrics today that suggests young children may spread COVID-19 really just as easily as adults, even if they're not sick. Researchers have said in the past we need more studies on this subject matter, but give us a little more insight on this. And does this really mean that kids need to stay out of the classroom this fall?
Yeah, that's a great question. So what this does is it just sheds more light on the fact that something we were debating, children under the age of 10, could they spread the virus? This is a study that illustrates that, yes, they can, and often in as much of a severity as adults can transmit to other adults. So the bottom line is that there's really no reason to think about children as much different when it comes to transmitting the virus than adults. What that means for schools is that schools, as you just reported on, have to consider all options. And I do think being in person is one of those options, but it means that you might really need to emphasize masks indoors, distance, and some schools don't have that ability, or if they're worried about that, then they might need to move towards more virtual environments. I think for parents, this also means that we shouldn't discount what the effects of this could be on children and children inside your household if you have adults in your household that have chronic conditions or other illnesses.
Yeah, important things to think about, and especially getting a little more information day by day. There was another thing that caught my eye. A group of over 1,000 health professionals calling for the country's leaders to close non-essential businesses, trying to stop the skyrocketing case numbers in several states across the country. These rollbacks, essentially going back to restrictions, is this the key to trying to get a handle on the situation and stop that rise?
Yeah, I think the only reason we're here is because the cases have really just grown out of control. We're talking, obviously, millions of cases of coronavirus infection and over 160,000 deaths every day climbing. So that letter signed, and it's climbing each day, how many doctors and health professionals are signing that letter. I think that that shows that there is enough concern in the health community that if we don't stop this in a very drastic way, then it might never get out of, under our control. But what I would say is that I feel very strongly that we can try to do what you see in New York, for example, we are under 100 cases, and that's because New Yorkers have really stopped. They've been pretty careful where possible to avoid environments where they could spread the virus or contract the virus. And masks, you see free masks going around the community. These are the types of things we can do, and we have shown that it can make a dent.
Okay. All of these measures, all in concert, all together. It'll be interesting to see what actually happens in different states because each one has been so different in their response to this. Dr. Kavita Patel, always great to see you. Thank you so much for joining us.
Pharmaceutical giant Johnson & Johnson released some promising news about a possible coronavirus vaccine. Researchers there have a vaccine that's proven to protect monkeys from COVID. A single dose produced a strong immune response in 6 monkeys. In fact, they said it prevented infection and close to complete lung protection from the virus. Human trials have just started in the U.S. and in Belgium as well.